What if science quietly discovered something about prostate health and most people misunderstood it? Over the past few years, you may have seen headlines or social media posts making bold claims about cancer risk and very personal habits. Some of those claims sound shocking. Some sound too good to be true. And many leave people confused about what to believe. Today, we are not here for shock. We are here for clarity. Because when it comes to cancer, misunderstanding science can be just as harmful as ignoring it. This topic appears online for one simple reason. A number of scientific studies observed something unexpected, and the internet ran with it. Those studies did not claim a cure. They did not promise prevention. They did not tell people to change their lives overnight. But once research leaves medical journals and enters social media, nuance is often lost. What remains is usually an oversimplified headline. Stripped of context, stripped of caution. That is how confusion begins. So before we discuss what the science suggests, we first need to understand how medical information gets distorted. Hello, I'm Dr. Narita. I'm a physician working in the field of urology, which focuses on the urinary system and male reproductive health, including the prostate. As men age, the prostate becomes increasingly important to monitor, not because problems are guaranteed, but because early awareness matters. In clinical practice, I often see two extremes. On one side, men who avoid any discussion about prostate health until symptoms appear. On the other, men who become anxious after reading incomplete or exaggerated information online. Neither extreme is helpful. My role as a physician is not to alarm you and not to reassure you falsely, but to guide you using evidence. That is what we will do here. Let's talk about the research itself. Several large, long-term observational studies followed tens of thousands of men over many years, sometimes decades. These men were asked about their health, lifestyle factors, and medical history. Researchers then observed which individuals developed prostate cancer over time. When the data was analyzed, scientists noticed an association between ejaculation frequency and prostate cancer risk. Men who reported higher frequency showed a lower observed incidence of prostate cancer compared to those with lower frequency. This observation raised an important scientific question, but observation alone is not a conclusion. This is where many misunderstandings occur. In medicine, an association does not mean a cause. It simply means two things appeared together more often than expected. For example, people who walk regularly often have better cardiovascular health. That does not mean walking alone prevents heart disease. It means walking is often part of a broader healthy pattern. The same principle applies here. These studies do not prove that ejaculation prevents cancer. They suggest that certain patterns of health may be linked, and that link deserves careful study, not sensational claims, and this distinction matters because responsible health decisions depend on it. To understand why researchers even looked at this association, we first need to understand the prostate itself. The prostate is a small gland located below the bladder and in front of the rectum. Its primary role is to produce fluid that becomes part of semen. Throughout a man's adult life, the prostate remains active. It responds to hormones, inflammation, age-related changes, and overall metabolic health. As men get older, the prostate naturally undergoes structural and functional changes. These changes do not automatically lead to cancer, but they do make the prostate more sensitive to long-term stressors, including chronic inflammation. That is why urologists pay close attention to anything that may influence prostate environment over time. One of the most discussed scientific theories involves chronic inflammation. In many types of cancer, not just prostate cancer, long-standing inflammation is considered a contributing factor. The prostate produces fluid continuously. If that fluid remains stagnant for long periods, some researchers believe inflammatory byproducts may accumulate. The theory suggests that regular release of prostate fluid could help reduce this buildup. To be very clear, this is a hypothesis, not a proven mechanism. In medicine, hypotheses are starting points for research, not final answers. Scientists explore these ideas cautiously, testing them over time before making recommendations. Another area researchers examine is hormonal regulation. Hormones such as testosterone play a role in prostate activity. Ejaculation frequency may reflect broader aspects of health, including hormonal balance, cardiovascular health, and metabolic stability. In other words, ejaculation itself may not be the protective factor. Instead, it may be a marker of overall physiological well-being. This distinction is critical. In medicine, we often find that one visible behavior represents many invisible health factors working together. If you are wondering why doctors do not make direct recommendations based on these findings, the answer is simple. Observational. Studies cannot control every variable. They rely on self-reported data. They cannot account for every genetic difference, lifestyle choice, or environmental factor. That is why responsible medicine avoids turning correlations into prescriptions. Caution protects patients. These discussions become especially relevant after the age of 40. Prostate cancer risk increases gradually with age. That is also when early screening conversations should begin, particularly for those with a family history. Understanding research does not replace screening. It enhances awareness, and awareness leads to earlier action. At this point, it is extremely important to slow down and correct some common misunderstandings. This research does not mean that ejaculation frequency determines whether someone will or will not develop prostate cancer. It does not mean that increasing frequency provides protection, and it certainly does not mean that this replaces medical screening, testing, or professional evaluation. Prostate cancer is a complex disease. It is influenced by age, genetics, family history, diet, physical activity, environmental factors, and access to health care. Some men with very healthy lifestyles still develop prostate cancer. Others with multiple risk factors never do. That reality alone should remind us why simple answers rarely exist in medicine. Any online claim that presents a single habit as a solution is misunderstanding or misrepresenting the science. One reason this topic became confusing is the way medical research spreads online. Scientific studies are written for researchers and clinicians. Social media, however, rewards short, dramatic statements. When nuance disappears, fear and false reassurance take its place. A headline that says, "Study finds association," quickly becomes "Science proves." That transformation is not science. It is marketing. As viewers and patients, learning to recognize that difference is part of protecting your health. Responsible medicine never rushes to conclusions. So, what should you actually do with this information? First, if you are over 40, have a conversation with your healthcare provider about prostate health. That conversation may include understanding your personal risk, discussing family history, deciding when screening is appropriate. Second, focus on overall health patterns, regular physical activity, balanced nutrition, managing stress, and maintaining a healthy weight all influence long-term outcomes. Sexual health, when approached responsibly and comfortably, is simply one part of general well-being, not a treatment and not a danger. The most harmful habit related to prostate cancer is not discussion. It is delay. Many men delay care because they feel uncomfortable asking questions. Others assume that silence equals safety. In reality, early awareness improves outcomes. Prostate cancer, when detected early, is often highly manageable. That is why informed conversation matters, not fear and not avoidance. Science exists to guide us, not to shame us. If there is one message I want you to take from this discussion, it is this. No single habit defines your health, but understanding evidence, asking informed questions, and seeking guidance early can make a meaningful difference. Science is most powerful when it is explained responsibly. I'm Dr. Narita. Stay informed, stay balanced, stay healthy.